So the other important tumor marker that we commonly use is the CA125. CA stands for cancer antigen 125. Recently I had a young woman around 21 years who presented with fever and then neutropenia and then depressed platelet count and then abdominal pain. And, all the routine investigations were normal except for the CBC abnormality. There is associated increase in the liver enzymes. Incidentally, we found that the right ovary is cystic. We would like to know whether the ovarian cyst is a simple cyst or a benign cyst or a malignant cyst. We did some of the antigens, tumor markers, the CA125. It turned out to be negative. The girl is doing well now. We require to now do something for the cyst, which is a benign cyst now. So to say, in patients who have non-mucinous ovarian cancer detected by monoclonal antibody to CA125, 80% of the ovarian cancers, non-mucinous ovarian cancers, they are positive for CA125. Ovarian cancers can be mucinous and non-mucinous. So among the mucinous ones, the CA125 is not very useful. Endometrioid type is not very useful. For mucinous ovarian cancers, CA125 is usually positive in non-mucinous ovarian cancers. Elevated in ovarian, endometrial, pancreatic, lung, breast, colon cancers, and also during physiological conditions like menstruation and pregnancy, and in benign conditions like endometriosis and other gynecological and non-gynecological conditions. Okay, this is to say this antigen is specific if it is non-mucinous ovarian cancer. If it becomes non-specific because it is false positive in some of these cases. Useful in monitoring the ovarian cancer recurrence and treatment, screening of high risk population, BRCA1 and 2 carriers. In those people, the risk of breast cancer is high, and if you do also CA125 is also positive, then the chances of breast cancer are high. It is not useful as a routine screening agent, but nonetheless it is useful in certain specific ovarian cancers, non-mucinous type, and also in persons who have BRCA1 and 2 carriers. This particular marker will be of great use. As far as CA125 and ovarian cancer is concerned, CA125 is a cell surface glycoprotein present during the embryonic development of coelomic epithelium and is present in adult structures derived from the coelomic epithelium. For follow-up, an increase may predict recurrent disease precedes clinical recurrence by many months. More than 80% of the epithelial ovarian cancer cell types are serous more than endometrioid, clear cell more than mucinous. So among the ovarian cancers, the cell types may be serous or endometrioid, clear cell or mucinous. This particular antigen is useful in non-mucinous, non-endometrioid types of cancers. Correlates well with the tumor bulk. In endometriosis also, it is commonly raised. Increased levels are found in pelvic inflammatory disease and in the first trimester of pregnancy. So these are the pitfalls. One need to be careful in interpreting the positive result as cancer because some of the gynecological conditions and non-gynecological conditions and physiological conditions like pregnancy, menstruation can throw a positive test.